Prostate cancer is the most common cancer affecting men. Yet, it often goes unnoticed. Each year, thousands of diagnoses could be made earlier simply by recognizing the early signs. In this video, we'll discuss 10 symptoms you should never ignore. These signs may sometimes be subtle and aren't always indicative of cancer, but they can make a critical difference when it comes to early detection. Stay with us until the end. I'll also share tips on how to act quickly and protect yourself better. This is a health issue that could save lives. The prostate is a small gland located beneath the bladder. It's part of the male reproductive system. Its role? To produce part of the seminal fluid, which is essential for fertility. Like any organ, it can be affected by diseases, and prostate cancer is one of them. It usually develops slowly, especially in men over the age of 50. However, in some cases, it can progress more rapidly. The good news is that when detected early, it is highly treatable. That's why it's so important to recognize the signs and discuss them with a doctor. Now, let's go over the 10 signs that may indicate a problem with the prostate. While these symptoms don't always point to cancer, they deserve your attention. You start noticing that your urinary flow is weaker than before. Sometimes you need to strain or wait a moment before urine comes out. This issue could indicate an obstruction or compression in the prostate area. Getting up to use the bathroom several times a night might seem harmless, but if it becomes frequent, it's a warning sign. An inflamed or enlarged prostate can press on the bladder, causing this sense of urgency. Seeing blood, even in small amounts, in your urine or semen, is a sign that should never be ignored. It could indicate an injury or irritation in the prostate, or even a more serious issue. Persistent pain in these areas could be linked to the spread of prostate cancer to the bones. This pain is often dull, localized, and does not go away with rest. If you're losing weight without changing your diet or exercise habits, it could be a sign that your body is fighting an illness. This symptom is often seen in advanced cancers. This is not just temporary fatigue, but constant exhaustion. Even after a full night's sleep, cancer can affect the metabolism and reduce the energy available for daily activities. It could indicate inflammation or pressure caused by an abnormally enlarged prostate. After urinating, you still feel like something is left in the bladder. This could be related to a partial obstruction caused by an enlargement or a tumor in the prostate. Urinary infections are rare in men. If they occur repeatedly, it could signal an obstruction or chronic irritation in the urinary tract, often related to prostate issues. Swelling, especially in the ankles or calves, can indicate an obstruction of the lymph nodes. This obstruction is sometimes caused by cancer that has spread. The pain may be accompanied by a feeling of heaviness. If you notice one or more of these signs, the first thing to do is to consult a doctor. They will be able to recommend the appropriate tests. The most common is the digital rectal exam, a quick and painless procedure that checks the size and texture of the prostate. It may be followed by a blood test measuring PSA, a specific prostate marker. These tests are simple but very effective in detecting any abnormalities. Rest assured, of course, not all of these symptoms necessarily mean cancer. But early detection is a real weapon. It allows for quick treatment, often with minimally invasive methods. If you're over 50 or have risk factors, consider asking your doctor if it's time to begin regular screening. This follow-up can truly make a difference for your health. To prevent prostate cancer, several simple actions can reduce the risks. A healthy lifestyle is key. First, a balanced diet rich in fruits, vegetables, and fiber can help maintain a healthy prostate. Reduce your intake of saturated fats and prioritize lean protein sources. Staying active, even with moderate exercises like walking, is also beneficial. Physical activity helps maintain a healthy weight, which can lower the risks. And of course, avoid tobacco. Smoking is never good for your health, including your prostate. As for screening, it's important not to overlook it, especially if you have a family history. If a father or brother has had prostate cancer, screening should start earlier. Talk to your doctor to determine at what age you should begin regular checkups. These measures, combined with early detection, are the best ways to take care of your health. Thank you for watching this video. Don't forget to share this information with those around you. Above all, take care of yourself.